An ECG, or electrocardiogram, is a test that's used to measure the electrical activity in the heart. This is how the electrical signal looks. You have a P wave, a Q, an R, an S, and a T. You also have space in between all of these. For example, the space between the P and the R is called the PR interval, and this is 0.12 to 0.2 seconds apart. The QRS complex is 0.06 to 0.1 seconds apart. There's also the QT interval, which is the space between the Q and the T, and this is 0.4 seconds. Now the P wave means the atriums are depolarizing and contracting. The QRS is the ventricles depolarizing and contracting, and the T wave is the ventricles repolarizing and relaxing. You should also know that the signal is actually drawn on an ECG strip. When we take a look at this ECG strip, we see that the top left has a little line. From that top left line to the middle is 3 seconds. From the middle all the way to the right is another 3 seconds, for the total of this ECG strip to be 6 seconds long. We also have little boxes here. Every single little box is worth 0.2 seconds. If we zoom into that little box, we see that it has even more tinier boxes, each one being worth 0.04 seconds. Alright, so the first rhythm we're going to talk about is called normal sinus rhythm. And when we take a look at the ECG strip, we see that there's a P, a Q, an R, an S, and a T. All the components of a normal ECG. And then it just repeats again, P, Q, R, S, T. We also need to take note that the distance between each QRS, each R to R, is the same. So normal sinus rhythm is expected. This is a good rhythm. We want patients to have this. P, Q, R, S, T is all there. The heart rate is between 60 to 100 beats per minute, so you don't have to do anything, you just document. The next normal rhythm is sinus tachycardia. And when we take a close look at it, we see that the P, the Q, the R, the S, and T are all still there. There's just more of them. So how we get the heart rate is we count each R. So there's 13 total R's here. Then we want to multiply that number times 10 because this is a 6-second strip. So the total heart rate is 130 beats per minute. Oftentimes, the cause of sinus tachycardia is going to be pain, anemia, hypovolemia, CNS stimulants, and hyperthyroidism. But there's many more causes. P, Q, R, S, T are all still there, but the rate is above 100 beats per minute. What you want to do is treat the cause. So if they have pain, then treat the pain. If they have low fluid, then give them fluids. The next rhythm is called sinus bradycardia. And when we take a look at the rhythm, we see that P, Q, R, S, T is all there, but there's less of them. There's only 4 in this case. And if we multiply times 10, that makes 40 beats per minute. Now, what causes sinus tachycardia can be medications, hypothyroidism, stroke, increase in intracranial pressure, which we'll discuss later, and being an athlete. This rhythm still has P, Q, R, S, T there, except that the beats are less than 60 beats per minute. Now, how you know you have to treat sinus bradycardia is if the patient is symptomatic. That means they have a decrease in cardiac output. Decrease in cardiac output means the heart isn't pumping good enough, and the patient is going to experience low blood pressure, dizziness, weakness, and syncope, which means they can faint. If the patient is experiencing these symptoms, then we want to give them the medication atropine. Atropine is an anticholinergic that increases the heart rate, but it also causes a drying effect. The side effects of atropine is blurred vision, urinary retention, dry mouth, and constipation. Or how I like to say, you can't see, you can't pee, you can't spit, and you can't shit. You also need to know that you don't give this drug to anyone with glaucoma, urinary retention, or constipation, specifically someone with a paralytic ileus, which means the bowels aren't moving. Now, if your patient is still bradycardic even after the atropine, then we want to move to something called transcutaneous pacing, which is a fancy way of saying a temporary pacemaker. You want to make sure you put both pads on the top and the bottom of the heart, making a sandwich of the heart. After the temporary pacemaker, we want to make sure the patient gets a permanent pacemaker. Now, a pacemaker is a surgically placed device that tells the patient's heart when to beat. It's normally set to 60 to 100 beats per minute. It's programmed externally, and on the ECG, we'll see a pacemaker spike. The pacemaker spike has to be around the P wave because it initiates the electrical signal. If a pacemaker spike is not around the P wave and there's no QRS after the pacemaker spike, that means the pacemaker has failed to capture. This means there's issues with a pacemaker that need to be resolved. Now, when you discharge a patient that has a pacemaker, you have to teach them a few things. The most important thing you teach them is to avoid magnets, like MRIs, metal detectors, or security wands. This is because it can interfere with the electrical signal it sends the heart. Now, what is okay to be around is microwaves, garage door openers, and they can still take baths and swim because it's surgically placed under the skin. The last thing you want to teach them is to take a daily pulse to make sure it aligns with the pacemaker setting. Alright guys, that's everything you need for ECGs.